Hi, my name's Sam Acuerda, and my community health role that I was given was school nurse. So I will, discuss that for a little while. This is my infographic. Peruse at your leisure. First off, I want to start off with education. Of course, you got to be a licensed RN. Not too many schools, though there are nationally, that accept RNs with an AA. Most either want you to be in a BSN program or have a BSN, and some schools in the nation only accept masters in nursing. The National Association of School Nurses, they call for a BSN, and they call for the school nurse to have a BSN. Some of the training that you should have is be from a school that's accredited by the American Association of Colleges of Nursing or by the National League of Nursing. The NASN recommends for school nurses to pursue a school nursing certification and a state certification, which is not governed by a nursing administration or a nursing association. Some of the clinical experience that a nurse should have is, especially when putting on a resume, is to emphasize their ability to work autonomously and with flexibility, because as a school nurse, you will be working autonomously a lot. You may have UAPs or people under you or working with teachers, but the RN is kind of the say for health on the school campus. So the roles and responsibilities as a school nurse functions in an expanded role, kind of adding to that being autonomous. The principal role of a school nurse is supporting student success and just supporting student success and their health. School nursing is a specialized practice of nursing. It protects and promotes student health. It protects and promotes the facility's optimal development and advances academic success. School nurses are grounded in the ethical and evidence-based practice. They are leaders who bridge healthcare and education. They provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop their potential. That being said, a school nurse needs to have self-confidence and the ability to develop a curriculum on their own. Again, working towards, school nurses are very autonomous. Another part of their role is the health promotion and disease prevention. They triage and treat acute issues, maybe a broken limb or something happens, someone gets hit in the head. They manage chronic conditions like diabetes, asthma. They also offer psychosocial support. They train teachers, bus drivers, and other school staff to prevent, recognize, and treat food allergy reactions. Again, the associations specific to school nursing is the National Association of School Nurses, or the NASN, and the American Nurses Association. Some of the pros of school nursing are the hours. They work Monday through Friday. They get every holiday that the school has off. They get summer off. However, there's a caveat to that, because even though they are working school between school hours, oftentimes their workload is large, and they cannot finish all their documentation and everything they need to do within the school hour time frame. Sometimes working very late into the evening, and they also work over summer to prepare for the next school year. Some of the cons of school nursing is the redundant documentation, insufficient time Some language barriers sometimes. It's good to learn a second language. Financial constraints, because the funding is also being reduced. You can see that a lot of school nurses are working part-time. 14.5% are working part-time, and 24.7% in the nation does not have a school nurse or is not requiring one. So the funding is just being reduced. Not enough personnel. One nurse can be responsible. Another con is one nurse can be responsible for up to 1,685 students, which is a very large workload and hard to manage, and more than one nurse should have to manage. The national salary mean is $63,393, which is not that much, especially on a school budget. So there's salary ranges. However, 10.8% of the national average, well, in the national average, there was 10.8% that made $71,000 or more. California and New York being the highest paid school nurses, upwards to 90,000, 93,000. The number of positions, there are 95,776 full-time equivalent school nurses across the country. And like I mentioned, 25.2% of schools do not employ a school nurse. The local work environment is students and parents may not understand health conditions, which makes it difficult to work as a school nurse and having to do that education. The high workload seems to be consistent across most nurses' opinions. They have a lack of resources. They experience budget cuts, reduction of hours, furloughs, and delegation, and oftentimes having to delegate to UAPs. And they do not have enough space for the health room. A lot of nurses have expressed that their health rooms or offices are quite small, not enough to treat a student and speak to another student, or have a student go and sit, try to recover maybe from heat stroke or feeling nauseous. The work condition can be very hectic, overwhelming, and stressful. So, as I've been saying, speaking of the role and responsibilities and how this fits into the core functions of assessment, policy development, and assurance. School nurses assess often. Every time there's a student sent to their office, they're doing assessments. Every time they're called somewhere, they're doing assessments. They have to assess their school. They have to assess what kind of students they have, what kind of health needs they may need, who has chronic illness, who doesn't. So that's how they fit and function into that core function. They work with the national associations to develop policies and maybe make it a requirement to have a school nurse, maybe more school nurses, and they assure they assure the health of their students. Another thing is they monitor health, they diagnose and investigate, inform, educate, empower. They mobilize their community with mobilizing the families, mobilizing the bus drivers to participate in the care and well-being of the students. They enforce laws. They link students to care. If they discover a chronic condition, or if they discover any kind of issue, maybe an acute issue like a broken limb, they assure a competent workforce by giving, seminars, educating those on how to recognize allergic reactions. They evaluate and they research. School nurses are a key to improve children and young people's health and well-being by delivering the health promotion as stated, providing health advice when asked. They are active actively participating in the treatment, education, and family support. They are safeguarding services coordination. They do health education sessions such as assemblies or classroom talks. They do hearing and vision assessments. They support children and young people with long-term conditions such as asthma, epilepsy, leukemia. They are a key component for sexual education.